year.
Do you feel that it is possible that you're beyond the sweet spot in the industry right now?
Well, I think not, particularly for companies that specialize in new product opportunities like AMERIGROUP. There are 42 million people who are served by state Medicaid programs and CHIP programs, and $200 billion industry, of which managed care is a very small percentage at this time. And that industry is going to be over $285 billion in the next 4 or 5 years. So I think there's tremendous growth opportunities for our company.
On behalf of AMERIGROUP Foundation, I want to welcome you to the first AMERIGROUP Leaders Forum. We're very proud to collaborate with Norfolk State in this unique speaker series on entrepreneurship. It's through these kind of public and private partnerships with the School of Business here that we hope to foster entrepreneurial enterprise in this community, cultivate and attract entrepreneurs to Hampton Roads, and to give our future business leaders an opportunity to see the wonderful aspects of entrepreneurial thinking and the entrepreneurial lifestyle.
Well, we think that to ensure proper access to health care, that insurance has to be affordable. And I think that every American needs to participate in the health insurance program and the health insurance pool to ensure that when you have a problem, an injury, that there is access to a primary care physician, there's access to proper health care services. So I think by having everyone participate in some way, that will begin to alleviate some of the problems. I also think that the systems have to be accountable and organized and using modern management techniques to improve cost and quality.
It's great being back in this city on the week of the 5th anniversary of 9/11, a sad yet interesting time. AMERIGROUP, as some of you probably know, began its IPO on September 11th, 2001. And in just a few short weeks, we got back on track with the help of another group of great American heroes, the New York financial community, who saw that it was clearly time for America to get back to work. Only 2 people came here today to hear me speak, my wife and my mother. Okay, all right, just my mom then. After college, obviously I did get a job, and it was a great job with Ernst & Young. In less than 1 year at Ernst & Young, I was laid off. Well, okay, I was fired. It was a scary time. You may know that fear. 20 years later, in October of 1999, Ernst & Young awarded me the Mid-Atlantic Entrepreneur of the Year. Life is funny. Never give up.
Having these kids with the proper access to care, with disease management on the 5 or 6 diseases that young children tend to have, it's going to save the overall health care system. It's going to save hospitals uncompensated care costs and employers additional expenses. We serve 1.5 million people, been doing it for over 12 years in 10 states, and every day we focus on very specific techniques of early case finding these young kids, average age 14 is our member, finding these kids, applying disease management techniques. We have over 800 doctors, nurses, social workers that work just as our associates, as our employees out every day, moving these kids into appropriate levels and processes of care.
Why are we passionate? Access to health care for Americans is vital. It is up to our generation to ensure the legacy of our grandparents for our grandkids. It's a big idea. We must improve this system of health care in this country. And I think most importantly, and what we're most proud of, is that we are becoming the voice of health care for children and their mothers and the disabled, the sickest of the sick, and the poorest of the poor. And there's much more to do, and we will do that with your help.
But I hope we've been effective in getting our message out to you today. We thank you for coming.